Hello and welcome to the Sherwood Exchange, a place for everybody to visit. Everybody from eco-conscious residents to people who are coming to donate clothing or household goods, to people who are struggling financially, maybe to students, families, even your next door neighbours, to the richest resident of Sherwood. We're here for everybody, so everybody's needs and considerations must be incorporated into the service we provide visitors to our beloved food exchange. So just as you might expect good customer service at a shop or a hotel, please be mindful that our visitors also deserve this, and may have found it hard to approach us today due to either a perceived stigma of what other people might think of them or concern there, or even the fact that they might not have found us, they might have taken a while to find us. Therefore, it's important that we work hard to ensure that people feel comfortable about accessing us, and that any myths about us being for the down and out or destitute, etc., are thwarted straight away, as we need our visitors to come back time and time over again and to bring as many friends and people they know as possible. So to ensure this, please always ensure to be welcoming and gracious for the time and visit. Be grateful that they've come today and make sure they know that. Do be polite and professional at all times and give our visitors the sort of service you would expect at a decent hotel. Good manners don't cost anything, and we are here to be kind and helpful, and also to demonstrate that to our visitors. Please also refrain from judging anybody or making judgmental comments, as we might have all sorts of visitors, from the super rich to people who are struggling to make ends meet, and we cannot judge a person by their appearance, and certainly we don't let them know we're judging them either. Everybody is welcome here and we appreciate their visit. However, should you feel less than welcoming at the start of your shift or feel like you have little joy to spread on to our visitors, just let your team know so they can support you. Having a bad day is not a crime, as long as we can all pitch in and support you. And of course we all have them, so please always be as open as possible so that we can ensure that you have less social contact if you're feeling flat or unwilling to talk to customers or visitors. And if you are talking to visitors, we would also like you to listen to them and be willing to signpost them wherever needed. And this training is all about helping you find the skills or enhance the skills you probably already have to ensure that you can signpost customers when needed. Finally, as we operate in a small space, we also have to keep people moving on in and out of the exchange, so to avoid overcrowding. And more importantly, we also need to ensure that our exchange is both tidy and hygienic, as if we're not going to have repeat custom. So our role is to welcome visitors in a non-judgmental manner and to take brief information from them. We're also here to collect donations from visitors, mark them up and store them in our exchange. We're also here to rotate stock and store it safely, and to be polite and engaging to visitors. And we're also here to help visitors with choosing items if they need our help, or by signposting and advising them on supportive services where necessary. Like I said before, we're here to move visitors along so their visits are brief yet purposeful. And we're here to signpost, and we're also here to adhere to food safety and health and safety to ensure that our exchange is clean and hygienic for all to use. And we're also, most important, our role is to work as a team, to support each other and to have each other's backs. And what I mean by that is to know exactly where your teammates are at any time and be ready and willing to step in if you ever feel they need support. And we're here to support each other should we ever feel at threat or need an extra hand. However, our role is not to. So what are we not here to do? So we're not here as counsellors, and we don't expect you to counsel people. Likewise, we don't expect you to take on their problems and aim to solve them, or to worry alone about people's issues. This is what your team is for. You know, we worry by talking with each other or highlighting any worries we have with the lead volunteer or myself. We're not here to lift heavy stuff unless you feel comfortable with doing that, but we'll never put you in that position. And we're certainly not here to help for you to feel that you have to help people outside of the exchange. Your role begins and ends within the exchange. So if anybody ever asks you to do something outside of the exchange, politely refuse and tell them that your role is to help them here but not outside. Likewise, you don't help or befriend people outside the exchange too. So again, be very careful, because these people are in effect your customers or visitors. So actually extending a relationship outside the exchange may lead you unprotected, may leave you to basically be you could be susceptible to anything that person subjects you to without the protection of working within an exchange. You only know these people as visitors. Obviously, unless your friends come in as friends, that's different, but please be very careful. We also don't lend visitors money or our phones, as once person does this, it sets a precedent, and then we're seen as somewhere where people can get food or get money, or belongings, and that's not us. Yeah, we don't lend visitors resources which are ours. So we might say, oh yeah, I've got something at home, I can bring it in for you, but bring it back. Don't do that. If you want to lend, just bring it in to give, yeah, and have it in the exchange. Or you might instead say, well, I did have this item, I no longer need it, I will bring it into the exchange. If in doubt, always ask, or say you need to ask for confirmation if ever asked to do something by a visitor you're not sure about. We all have different boundaries when it comes to body language, and some of you may well be people who hug or even kiss when greeting friends, but in the exchange we need to keep our boundaries, and the best way to ensure that visitors or customers are not crossing our boundaries or personal space is to not have any physical contact with people when they come into the exchange. But instead you can still be positive, and a good open posture can do the trick of showing visitors that you are relaxed, you're warm, and you're confident in your stance. This will then enable visitors to establish trust and enable them to feel safe and reassured around you. Okay, so open means open out arms. Don't fold them in front of you or behind your back if possible. But also you don't need to do jazz hands either. Just hold your hands. Just be conscious that if you had your hands open, let's say on your sides, that then makes you look more open and approachable. Whereas if you close your arms, that makes you feel unapproachable or defensive. If you smile first, you will find that your body posture will also change, and you will come across as friendly and approachable. And this is enough to put people at ease. And if it's just a smile, that isn't enough. And in behavioural psychology, if somebody makes gestures of open hands, it can indicate that they're open and honest. And this gesture can be used to emphasise the importance of what has been said, or simply to show the person making the gesture that the person making the gesture is approachable and welcomes other people to speak with them. Turning the palms to face upwards with the hands open can also indicate submission. Historically, a gesture of open hands showing the palms was intended to demonstrate that there were no weapons being carried or concealed. Therefore, opening your hands can show that you're not at threat, and you're ready to have conversation. So really, again, open conversation, open arms, open hands. Even if you're not used to smiling, practicing smiling more can be a really good thing, as a smile can hide a whole load of nerves and anxiety and help to make your day go much smoother and better. And actually, studies have shown that when you smile more, people also smile back. So you're not only enhancing your mood and well-being, but other people's, and then basically making the exchange a happier place. So every time you greet a visitor, think about how you'd like to be treated if you were that visitor, or even how you'd expect your loved ones to be treated by other people in their lives. Even if you dislike a person, stick on that smile and present as open, and that interaction will go far smoother if you do so. In behavioural psychology, smiling at somebody shows that you are friendly, open and approachable and likeable. It also shows that you like and respect the person you're smiling at, and it will help to strengthen the bond on both personal and professional relationships. So even outside the exchange, if you're having a difficult conversation, perhaps with a friend, smile a little or smile when you greet them. When you smile at somebody too, it also indicates that you're actively listening, as this can encourage friends or colleagues to be more confident about sharing their opinions or suggestions with you, or in our case, visitors. People who smile genuinely and who do also come across as approachable are more likely to be successful within working in a team, apparently, as they'll be regarded as likeable and respectful. People also like to discuss problems with somebody who's seen as approachable, and a smile does that. A little information about eye contact too. So eye contact can be used positively to show confidence and trust and to promote open conversation. If you regularly look at somebody during eye contact, it shows that you mean what you're saying. And it can also be used as a turn-taking cue to show that you are ready to hear what the other person has said. So I don't mean like fixed stare. You can look away when you're talking, but again, check in with the eyes if you can do. Or another tip, if you struggle with looking in people's eyes, look towards either ear or into the direction of the left or the right ear even. Nodding or tilting the head from side to side. Nodding while somebody speaks shows that you are focused on what they are saying and listening respectfully to them. It can show that you agree with them and what they're saying, or just that you're acknowledging that their thoughts and opinions are valid. Tilting the head to one side shows that you are listening attentively and that you are considering what they are saying with respect, whether you agree or disagree with them. Nodding or tilting the head during conversations are positive body language and respectful gestures that indicate approachability and openness, and also that you're actively listening to them. Likewise, mirroring or facing your body towards the recipient of your conversation, or like your legs or arms, will also convey that you're interested in what the person has to say. And likewise, if you see visitors copying your mannerisms, which is what mirroring is, can't say that word. So say if you sort of twisted your hair as you spoke to somebody, they did the same, you've got them. And that means that they're also mirroring you because they feel comfortable and engaged with you. Please be aware though of personal space, however. So your personal space, which belongs to you, is always an arm's length around your body. So whenever anybody comes into that, you need to either side shuffle or go backwards. Some people aren't aware of personal space, so will do it without even thinking. However, some visitors may do this intentionally. And so a simple way to tell them that that is not okay is to move sideways, or even better, to lead them mid-conversation with you so you can get behind the table, and then that is affirming, this is my space. Negative body language can indicate defensive feelings. maybe perhaps lack of interest in the other person, or even dishonesty when we are not conscious of it. And again, negative or closed body language is a non-verbal cue that a person is feeling defensive or unwilling to engage. And we do this without even thinking. We might close our arms sometimes when we're cold, but often if it's closed, we're doing it, or we're doing it for a reason. So closing our eyes, for instance, even when we're cold, could portray that we want to protect ourselves, or close ourselves down to conversation with another person. Likewise, poor posture can make it seem like you're disinterested in what the person is saying. For instance, when you slouch, cross your arms, or turn away from people when they're talking to you, you're looking disinterested, defensive, or even borderline bored. Facial expressions can also show people how you're feeling, such as when people frown without even realizing it. Yet when you stand up or sit straight, look at people with a smile on your face, or keep your arms slightly open, you're telling them that you're approachable and open to conversation and happy to talk to them. If people do not feel like they want to talk, or they might be depressed or down, they might hunch themselves into themselves when they walk, with their heads down or arms closed, and may well already be avoiding your eye contact. Respect that and respect their boundaries, and only engage with them if they appear to respond to your, let's say, your highs or how you're doing today, your conversation. But don't otherwise, because that is a statement they're making. Signs we need to be aware of, though, which could indicate somebody is feeling hostile or could be risky towards us, is pacing. So if you see a person pacing up and down the floor as they're talking, they're angry or anxious, and they're not in a place for a decent, reasonable conversation. Clenching fists or standing on side on also indicates that they're considering attacking or attacking us. So again, if somebody's standing side on for you, you need to back out and get out of the room. Bring the team too with you. Fixed eye contact, as we said before, to the point where you feel as if somebody's staring through you, may indicate somebody's angry with you. Similarly, never say that word, darting eye contact. For instance, from you to the door or to an object might indicate a person's intentions. Now, if it's just to the door, that indicates they need to get out because you're talking too much to them. But if you see them looking at a door and then an object, that means you need to get out the door because they're considering using it and then getting out of the door. Always be attentive to the tone and volume of voices rising to shouting. And again, always have your volunteer, your teammates beside you, always know where they are, and always be ready to jump in if you feel a conversation is escalating. People perhaps shaking or appearing on edge as well, even if that's anxiety. Be on your guard, because when somebody's anxious, they're also scared. And when people are scared or anxious, they're not always thinking straight. So what you need to do at that point is either give people space, enable them to get in and out quickly. Don't converse with them unless they want you to do. Let them have what they need to do and let them go. If anybody's venting anger towards us, we definitely need to be on guard at this point. The best, and I say, in any time like that, obviously if you feel comfortable to do so, you might say to them, I prefer you not speaking to me like that, but actually we're in a small space. I'd rather you say, okay, what can I get you now? I'm just going to step out for a moment now. And just get yourself out of the situation. Please be also vigilant to people expressing extremist and discriminatory viewpoints. Unfortunately, we might get them because we are working with a lot of older people who may have prejudices to other groups of people. You are very much as well to say, I'm going to step away from this conversation now to change the subject, and then tell us about it and we will talk to them about that. Space invaders, again, be aware of those as well. People who don't respect your personal space boundary. As I say, if they're in an arm's length, keep moving away from them. Anybody who makes us rush or makes us feel compromised in any manner, why they're making you rush, they're stressed, but what's their intention? Again, just be very mindful of that and watch what's happening with your teammates. If that's happening, step in to diffuse. Anybody who asks us for things or makes demands on us in the same way is somebody to be careful around. I would say the bog standard thing is always step aside or outside to give people more space to make the selection if they're being like that with us. And even just walk out mid-conversation, because you're more important than that. I'll be back in a minute is what you say. And then make sure you're in the room, pick up from where your team members left off. Okay, what can we get you then, sir, or whatever? We need that person out, yeah? Trust your gut if something doesn't feel right, and if you get the vibe about somebody, protect yourself and protect the team. Get out of the room and alert for emergency help. And we'll come back to emergency help later on in this training. So what's an open question or a statement? Well, the same as open body language helps people talk more and lets people know that we're friendly and easy to talk to. An open question and statement does the same. So basically, anything that demands an answer and makes sure the conversation continues is an open question. And by doing open questions, then we can chat to people and see if they're okay. So, for instance, after greeting people and saying hello, consider using open questions such as asking them how they're doing, if it's the first time or a return visit, to make sure that people converse back with us. An open question is a question really that opens the door to more than one word responses from the other person. And if the person does not answer the question in detail, that means they don't want to talk. They're probably not in the mood to communicate with them, so respect that and be polite and helpful. And if a person does want to communicate with you, they will respond with a detailed answer to your question and may even ask you some more questions. Great. That's then when you can have a conversation with somebody. So when talking with them, be mindful of staying professional though, as you expect. And again, I always say professional like you'd expect a hotelier or a customer services representative to talk back to you at a tourist attraction. So only give them information you're happy with giving them about yourself, and be mindful that personal information will be remembered by visitors. Oh, they will ask you again, and ask them more questions. Make them feel good about themselves, because again, when you do that, they come back and they start to trust you. Always thank people for coming, and if you want to engage them further in conversation, think about topics you both share, such as discussing the weather, recycling, and whether they came in for anything and actually found it. Then ask them how the day is going, and if you sense they're up for a chat, a compliment is always a good way of getting a conversation started or continued. As is just asking them if they're aware of how the exchange works. Do say sorry too whenever accidentally getting something wrong or assuming, because we still do that even when we set out not to judge, as this conveys respect and makes that person feel valued. But please steer away from politics or any sort of groups you support or anything like this, as this can be tricky ground, as some of our visitors may not share the same viewpoints as us. Always be warm and smiling whatever you do though, and you won't go wrong, as this is what the visitors will remember most. And why are we doing this? Okay, well, the reason we're doing this, and we want people to trust us and engage with us, is so that we can also be there to signpost them and advise them whenever we feel that the customers are not doing well in life. So again, we can speak to them and prevent them from experiencing well-being or economical decline. So it's important that whenever you work within the exchange that you set up boundaries with customers. As we don't have a uniform, customers could think we're other customers. So when just so customers or visitors, as we call them, know who you are and what you're about in your role, always ask them if they know how to use the exchange. And even say, look, if you don't, just remember that you can come down at any time when we're open to either take stuff or donate stuff. And straight away, that then tells the customer that you're in a slight position of power there. But, you're in a position to help them with power. Then explain that with a small room, to ask people to queue and take a maximum of 30 minutes per visit to ensure everybody takes time to visit. So if you happen to be working on taking names, etc., that will be your job. And we'll also maybe say to them, look, we have a maximum of 4 to 5 visitors in at any one time, just to make sure that people are able to use the exchange safely. Even explain that we've got no ventilation and it's for their health and safety. Always remind them that we will need to take their names every time they visit, age and postcode. And we'll also need to take their consent that they will take full responsibility for the safety of any of the food or household goods taken from the exchange every time they visit us. This is because we cannot be responsible for the health and safety once they've taken items from the exchange. So do always remind them that, and you'll get people coming in saying, well, I did that last week, and say, well, every week we have to do it and we have to ask the same question. And if visitors have to wait, chat with them and ask them whether there is anything in particular they'd like today from the exchange. Talk to them about the time bank too, and ask them if they'd like to sign up to the time bank, and explain why they have to wait if need be. Always ask if people want to wear a mask too, especially if you suspect they've got symptoms of cold or flu. I think it's fair to say that we've all had experiences where we've not felt listened to. And it is horrible, especially if we go into a shop or a service. If we're not listened to or respected, we ain't coming back. So it's really important that our visitors do feel heard and listened to. And this next short video will demonstrate the power of being heard and listened to. As well as these tips, good tips for effective listening include being able to convey genuineness by being yourself. You're not bigger and better than them, you're just the same, and you are related to them as if you were relating to a relative or friend, but remaining professional. Like that customer services agent or hotelier you would meet at a hotel reception. You're accepting and friendly and definitely not judgmental, and always polite and helpful. Although admittedly all of us are judgmental to some extent, we do our best in this role not to indicate shock or anything other than acceptance. So this might involve us taking a deep breath at times and letting that breath travel all the way through our bodies and out through our feet within our mind's eye at times to ensure we're not looking shocked, and smiling also to cover any reaction to that shock, as people will tell us shocking things. It's also good to demonstrate empathy and to make an effort to see things from their points of view when conversing with them. So imagine for a minute how it must feel for them to be experiencing that distress, or for having to tell you what's on their mind. Even if it's hard for you to imagine, tell them how you appreciate them telling you, or how challenging it must have been for them to come to you to tell them how you're feeling. Just make them feel appreciated and valued. Definitely also show compassion, which means having empathy and a desire to want things to be better for them. So even if this means that you tell them that you just hope things will be better one day, that's enough. And that's enough for somebody to know that you're in support of them and they're not alone, because you're showing them concern and you're showing care. And this goes so far with people. And you can do that without being unprofessional. And it's a nice touch that people will remember, because quite often a lot of our visitors may be going into services where people are showing them none of this compassion. But again, if just for you to say, I really hope things get better, that must be awful for you, is really enough. And again, what we said before, use positive body language. And remember, open postures, open arms, eye contact. You can give it all, smiling, nodding, pointing your body or your ear towards what they're saying, mirroring them. All these gestures indicate that you're interested in what a person has to say, and that will make the experience they're having of speaking to you so memorable, and for the right reasons too. So as well as ensuring our customers or visitors have access to advice and information which can improve their lives or help them if they're experiencing well-being decline, etc., or anything else, we also need to safeguard our visitors and customers. So if anybody tells you something which concerns you, this training will teach you how to recognise it, record it, and then report it. So whilst you're in conversation with somebody, if they tell you something which concerns you, which might indicate they're being abused or they might be abusive themselves, recognise the signs of abuse and record it using an incident form which is kept within the filing cabinet of the Exchange. Or you could also go online, you could get one of our online incident forms upon our laptop we use in the Exchange. And be sure to record what you've heard using plain English. Record just what you have experienced, just the facts of what was said, who said it, and when it was said or encountered, minus any opinions that you might have. As I've said before, be mindful that a person could have access to that information at any time. So always write and record what you've seen, in light of knowing that that data could be accessible at any point, either by that person or even in a court of law if something serious happened to that person. The most important thing you can do then is report it to either your lead volunteer or myself, who is the designated safeguarding lead. That is your responsibility within safeguarding. My decision or your lead volunteers is about deciding whether or not to report what you've recorded to social care. It may be that further details are required, such as a person's contact details, address, and the names of other individuals involved, or even dates of birth. And these may need to be collected later, but always try and get a phone number and contact details of a visitor you're concerned about, so these can be used to contact the visitors further or even passed on to social care if required. So if you say you're speaking to somebody who tells you something quite concerning, what you want to say is, may I take a phone number or an address, because I need to ask now, need to speak to my supervisor, i.e. myself or your lead volunteer, and then get back in contact with you as to what they've advised. This not only gets their contact details, but means we can also pass them on to social care, but also it keeps them in the loop of what is likely to happen, etc., and shows that you're being honest and transparent and you're not promising anything, i.e. to not say anything about it because you're concerned and you're doing the right thing by getting further support and advice. Although we don't allow unaccompanied children into the Exchange, it's important to recognise that children will come in with parents and could be subjected to abuse, which Safeguarding Children 2018 broadly defined into 4 categories as physical abuse. This is when somebody hurts a child on purpose with the intent to cause harm. Emotional abuse, when the child's feelings and emotions are manipulated or shamed on purpose. Sexual abuse. This may be any sexual activity with a child or introducing a child to act in sexually inappropriate ways. And then there's also neglect, and this is when the child's basic needs for food, clothing, shelter, education, health and safety are not met. It's also important to recognise that children and young people may also experience a whole range of other forms of abuse, such as grooming, coercive control, and even financial abuse, which adults are subjected to. However, these forms of abuse are covered broadly within the 4 definitions given as physical abuse, emotional abuse, sexual abuse and neglect, as we've just described below, just now. But for more information, signs of physical abuse in children might include, although are not completely exclusive to, reports of injuries without adequate explanation or different explanations between the parent or the child, injuries on the soft parts of the body and a reluctance to show skin or an attempt to cover injuries, or even a change in the child's demeanour. Or definitely if you find a child is expressing fear towards adults, then again this could be an indicator of physical abuse or indeed any other abuse. Emotional abuse is the persistent emotional maltreatment of a child, such as causing severe or persistent adverse effects on the child's emotional development, and it might involve conveying to a child that they are worthless or unloved, inadequate or valued only insofar as they meet the needs of another person. It might involve not giving the child opportunities to express their views deliberately, or silencing them or making fun of them, or say what they say or how they communicate. It may feature age or developmentally inappropriately expectations being imposed onto the child, and these may include interactions that are beyond the child's developmental capacity, as well as overprotection and limitation of exploration of learning, or preventing the child from participating in normal social interaction. Emotional abuse may also involve seeing or hearing the ill treatment of another, or it may involve serious bullying, such as cyberbullying, causing the child frequently to feel frightened or in danger, or the exploitation or corruption of children. Some level of emotional abuse is involved in all types of maltreatment of children, though it may actually occur alone. Signs of emotional abuse might include a child who seems uncomfortable or lacks self-assurance, encountering struggles to control their emotions, having difficulty making or maintaining relationships, that's the child, or the child acting in a way that's inappropriate for their age, poor parental attachment towards the child, unresponsive or neglectful behaviour observed towards the child's needs, or for instance not taking the child to the doctors when they need to go, persistent negative comments made by the parent about the child, inappropriate or inconsistent developmental expectations of the child, for instance the parent that expects the child to be a genius and then when they're not a genius really emotionally abuses them. Parental issues and problems that supersede the needs of the child. So for instance, you might get a parent who knows, let's say, the dogs are dangerous in the house, but they're more bothered about the dog's health than the child's health, or a partner perhaps who's unsafe, but again they value their relationship needs higher than the child's. And also dysfunctional family relationships, including domestic abuse or problematic substance use, may also lead to emotional abuse or neglect. Sexual abuse may involve forcing or enticing a child or young person to take part in sexual activities. not necessarily involving a high level of violence, whether or not the child is aware of what is happening, but or may involve violence, sadly. The activities may involve physical contact, including assault by penetration, for example, rape or sex, or non-penetrative acts such as masturbation, kissing, all of that stuff, touching outside the clothing, all of the stuff which is not on. Sexual abuse may also include non-contact activities such as involving children looking at sexual images, watching sexual activities, encouraging children to behave in sexually inappropriate ways, or grooming a child in preparation for abuse. Sexual abuse can also take place online, and technology can be used to facilitate online abuse. And sexual abuse is not perpetrated solely by males, it could also be perpetrated by women or groups of people. Signs you need to look for that a child might be being abused might include blood or discharge on the children, under clothes. You might not see those, but they might describe them. Awkwardness in walking or sitting down, tummy pains, reports of regression back to bedwetting, tiredness, extreme variations of behaviour such as anxious behaviour, even angry behaviour, sexually provocative behaviour that is incompatible with the child's age or understanding, drawings or writing that's sexually explicit, direct disclosures too, although it's important to recognise that young children have neither the experience or understanding to be able to make stories up about sexual assault. Finally, neglect is the persistent failure to meet child's basic physical or psychological needs, likely to result in a serious impairment of the child's health or development or mental health. And neglect may occur during pregnancy as a result of maternal substance abuse, for instance. And signs of neglect might include, although are not exclusive to, frequent injuries, illnesses, infections that are not being treated or being ignored, poor hygiene such as dirty skin and clothing, body odour in children, inappropriate clothing for the weather or ill-fitting or unclean clothing, children presenting as hungry or malnourished, looking malnourished or tired, children who report missing school frequently or tend to be left unsupervised or alone at home. Any child turning up to the exchange on their own is definitely being subjected to neglect. It's also worth noting that children and young people may also experience other forms of abuse, which are described within the next slide, which focuses on specific types of abuse encountered by adults. However, most importantly, if you suspect any of this is happening or you have a feeling, you need to talk. But always, if you're dealing with the child at the time, always make sure the child speaking to you feels that they're being listened to and supported. Reassure the child that they've done the right thing by telling you. Inform them that you'll need to make notes of what they're disclosing to you. And this needs to be factual word for word. And emphasise as well that their abuse is never their fault. And take time, be patient, and let the child go at their own pace. And don't promise to keep information confidential between you and them. Explain that you need to share the information with the safeguarding lead now, who will be able to help. And don't talk, if that child is telling you but they're with the alleged perpetrator, do not talk to the alleged perpetrator about what the child's disclosed, as obviously that would make it worse for the child. Come and talk to us and then record it on an incident form. Sadly, there are so many types of abuse experienced by adults these days, as well as children, and each form of abuse may be indicated by a number of signs and indicators. Please do take the time to read these links in your spare time so you are aware of all the signs and indicators of the following types of abuse that adults might be subjected to, which are listed and explained as physical abuse, sexual abuse, emotional, psychological abuse, the same as children, and neglect and acts of omission, which would be a failure to provide or allow access to food, shelter, clothing, heating, stimulation and activity, personal or medical care, or providing care in a way that a person dislikes, or failure to administer medication as prescribed, or refusal of access to visitors. So neglect or acts of omission may happen to an adult in relationship, so it might even happen in a care home. We've then got financial or material abuse, which includes theft, fraud, internet scamming, coercion in relation to an adult's financial affairs or arrangements, including in connection with wills, property, inheritance or financial transactions, or the misuse or misappropriation of property, possessions or benefits. Then we've got discriminatory abuse, which is the unequal treatment of an individual based on age, disability, gender, or gender reassignment, marriage or civil partnership, pregnancy, maternity, race, religion, belief, sex or sexual orientation. And this can happen in relationships or even in residential homes where some of our visitors might live. We've also got organisational or institutional abuse, which is the mistreatment of people brought about by poor or inadequate care or support, or systematic poor practice that affects the whole care setting, and occurs when individuals' wishes and needs are sacrificed for the smooth running of a group, service or organisation. So we've got self-neglect, which is when a person is unable or unwilling to care for their own essential needs, and it could cover a wide range of behaviours that could be seen as self-neglectful. Domestic abuse, including coercive control, doesn't always have to be physical too. So coercive control is an act or pattern or acts of assault, threats, humiliation or intimidation, or any other abuse that is used to harm, punish or frighten or frighten the victim. For instance, it might even be to take away attention or love from a victim. Grooming is when a person builds a relationship with an adult who's at risk, so they can abuse them and manipulate them into doing things. The abuse is usually sexual or financial, but it could also include any other illegal acts. A forced marriage is where one or both persons do not consent to the marriage, and pressure or abuse is used to force them into the marriage. So it could be emotional pressure from the family, etc. It's also when anything is done to make somebody marry before they turn 18, even if there is no pressure or abuse. Modern slavery is an umbrella term encompassing activities when one person obtains or holds another human in a compelled service. Modern slavery includes, but is not restricted to just this, but servitude, slavery, forced labour, human trafficking. Female genital mutilation is a procedure where female genitals are deliberately cut, injured or changed, usually in some cultures prior to a girl's marriage or becoming a woman, and it is widely thought that by doing so, that prevents a woman from becoming aroused or gaining pleasure from sexual acts. Also, county lines, it is where illegal drugs are transported from one area to another, often across police or local authority boundaries, although not exclusively, usually to vulnerable children and also with adults who are coerced into it by gangs. And the county line is a mobile phone line used to take orders for drugs. And finally, cuckooing is when drug gangs take over the home of a vulnerable adult or even a young person through violence and intimidation, using it as their base for selling or manufacturing drugs. If you suspect an adult is being abused, find a quiet spot to listen to the adult and make sure you're conveying signs of active listening to make sure they trust you. Reassure them that they've done the right thing by telling you. Inform them that you will need to take some notes of what they're disclosing to you. Remember that these need to be informative, as we said before, factual, and they're not going to contain your opinions. Or you might say the only opinion might be this person appeared scared, yes, or anything like that you've seen. But don't promise to keep anything confidential between you and them, and explain that you need to share the information with a volunteer with safeguarding knowledge to ensure that you have enabled that you're doing the right thing for that person. Try to get the contact details and ask them for the consent to get further support. And then tell me or a lead volunteer and complete an incident form. Whilst recognising that adults are at risk of all these types of abuse, it's also important to know about adults at risk. And can't get my teeth in, an adult at risk is any adult aged over 18 who either presents as in need of care and support, or is experiencing or is at risk of experiencing abuse or neglect. And that adult at risk is a person whom, as a result of these care and support needs, cannot protect themselves from either the risk of it or experience of abuse or neglect. So if we've got somebody who we think needs care and support but isn't getting it, or we think somebody is experiencing abuse yet has not got the capability to look after themselves or get out of the abuse, this is then an adult at risk. So please also be mindful that the Care Act 2014 also defines an adult at risk as any adult aged over 18 who is clearly in need of care and support, or is experiencing any risk of abuse or neglect as a result of their unmet care needs. So basically, if they've got needs for care but they're not being met, that is an adult at risk. Also, as a result of those presenting support needs, and because, say, they've got presenting support needs and they're not able to protect themselves without receiving care and support from social care. So we might see somebody who's self-neglecting themselves, or maybe they're in a relationship which seems a bit dodgy. Well, if they're not able to protect themselves without care and support from another being, i.e. in this case social care, then they are an adult at risk. So this might be an older person we see who appears to be struggling to take care of themselves in an appropriate fashion. Somebody who might not be adequately clothed for the time of the year, or might be showing signs of not taking care of themselves, perhaps not taking medication. This adult, for instance, might not be reporting abuse. Sorry, beg your pardon. This adult, for instance, might be reporting abuse too, such as the failure of partners, carers or relatives to neglect their needs, to prioritise their needs. So again, if they are reporting it, we know that that person is at risk. And again, remember, an adult at risk is a person needing care or social care. And as with safeguarding children, please recognise these signs and record them onto an incident sheet to enable myself, Rachel, to report them to social care if necessary. When dealing with adults, being able to quickly assess whether they have mental capacity to take in and choose to take action on the advice you give them is also essential. So basically, whoever you are talking to, whether they can retain the information you give them and make sense of it during conversation with you. If they can make sense of that, they have mental capacity. But if they don't and they can't take in the information you give them and make sense of them, they do not have mental capacity. And that might be mental capacity to make an informed choice, to protect themselves, or to know what is right or wrong for them. So, for instance, a person with memory difficulties might not be able to keep up with the drift of the conversation you're having with them, and may not be able to retain information you gave them. This person does not have mental capacity to make a reasoned decision, as they would not be able to remember the information or advice you've given them. Okay, and it's worth saying, if this person lives with a partner who has got mental capacity, we know at least that partner hopefully is keeping them safe. However, if we suspect that a partner is abusive or not looking after their needs, then they are an adult at risk. So likewise, somebody who has drunk, let's say a lot of alcohol, will also struggle to remember and decipher what has been said to them, as their memory would be impacted by the state of intoxication. So they would not have mental capacity at that time when you spoke to them. So again, if you told them to you gave them some advice which was needed, perhaps you said to them, if they told you they wanted to run down the street naked, and they told you to do one and they said they're going to do it, they have not got mental capacity at that point to make a sensible and informed decision. Okay? So the Mental Capacity Act 2005 defines mental capacity as a person's ability to understand information and make decisions about life, or in the policy's words, having the sufficient understanding and memory to comprehend any situation you find yourselves within, and the ability to understand the nature, purpose and consequence of any act or transaction you make. What's important to note here is that a person always has mental capacity, and what's important to note here is that if a person has mental capacity, they can make unwise decisions. So an unwise decision might be to decide to run down the street naked, and say if that person was not drunk and they were able to retain information and hold a solid conversation with you, they have mental capacity to make an unwise decision. And basically there's nothing we can do to stop them, because it's not been evidenced that they do not have mental capacity. So if you find somebody is able to retain a conversation with you and indicates no signs of memory deterioration, yet tells you they're going to do something unwise, you can't stop them from doing that thing. You can only advise them against this decision. And what I'd advise is fill out an incident form so you've got this noted. And then we're covered. Say if anything was to happen to that person, our assessment at that time was that this person was able to take on the information but had made a decision not to take it on. In the same way, if somebody tells you that they're considering killing themselves and they have mental capacity to make an informed choice, you can only advise them not to do so, and to give them advice on how to get support. This is enough and would be deemed appropriate in a court of law should the worst ever happen, which it wouldn't do, but again, in the sort of work I used to do in social work, that was what we always used to go by. And when I used to do in my last job, used to have to advise a lot of people and deal with people excuse me, that did not lack mental capacity, yet were a danger to themselves. So the Mental Capacity Act is all about deciding when we can intervene and when we can't intervene with people. Excuse me. Excuse me, I've got a frog in my throat. Say another person was clearly intoxicated or experiencing an episode of psychosis or mania. They are definitely lacking mental capacity there, because their thoughts might be racing, or if they're intoxicated, their thoughts may be changed by the substance they're taking. All we can do at this point is record this information and then report a description of the person to the police. So if that person is headed out and told us they're running down the street naked, that's what we can do. But we cannot stop them by using any force, because again, we're not security guards. All we can do is make a note of it. And again, alert authorities if we've got a description, etc. So what to do if somebody comes into the exchange who might not even be giving you any reason for concern, but we can tell they've got memory problems and they might not have capacity which is constant to help them make wise or unwise decisions. what we can do in the exchange is write stuff down for them, and if need be, or what they've got from the exchange, because that list you're writing for them not only triggers their memory, but also helps a carer or the person on the other end know where they've been. Ask them how they're feeling today as well, and ask them if it's regular behaviour for them. You could say something like, we notice that you're struggling to remember things today. Is that normal for you, or is this regular for you? And again, if they say there's nothing wrong or they have no idea, again, that could be a memory loss, it could be a sign of dementia, or again, another potential capacity issue if there's any risk involved which we're worried about. Always check to see they're okay to go home or they're getting home, and check whether they've got a partner, family member or key worker who supports them during the daytime. Or you might say something like, yeah, who's at home then? Or are you off today? Are you going back to your partner? And they might say no, but again, we can document that then, because then we're thinking this person's got memory challenges, they appear forgetful, they've got nobody at home, and then at least we're making note of this, so when the time comes and we get their details, we can make a referral then to social care and say we're concerned about this person. Always share your concerns with me or the safeguarding lead or the lead volunteer. Always complete incident forms, because again, these are records of our concerns. And like I've said, it might be likely that we'll see visitors who are showing signs of early stage dementia and an inability to retain information within their memory. And there's lots of things, like we've just mentioned, which we can do to ensure these people are safer and anybody presenting with memory challenges should warrant further discreet questioning. And basically what you're trying to do as you're questioning is seeing if they're holding the drift in the conversation. You might even say repeat that one back to me. And again, if they're struggling to remember what they've just said, short-term memory difficulties, well, that would indicate a condition that's impacting the memory. So we're just going to make a note of that. And as I say, we'll write out whatever they've taken, any messages for them. And like I say, we're asking them how they're getting home and just making sure they're safe. So now you know what to do if we're concerned about any adult at risk or child or adult subjected to abuse. Here are some details on places we can sign people to as well, should they need to be advised about places they can go to accept further advice or support to help them alleviate any challenges they experience. So first, starting on housing support, as so many people are at risk of being homeless these days or are struggling to find suitable housing, we must always be prepared to advise anybody who tells us that they are homeless or about to become so, that they are homeless, to report to Loxley House in Nottingham City Centre, which is the council's headquarters. Or if they're from Arnold or Gedling, they must go to Gedling Borough Council or Nottinghamshire headquarters, which is in Arno Vale Park in Arnold. Do advise them also to make contact with Framework Housing if they're sleeping rough or fearing they might do, as Framework also have housing options. We've also got Emmanuel House in there, which provides a drop-in centre, providing people with hot meals and drinks, warm showers, clean clothes, toiletries, everything, haircuts, etc. And that's open in the daytime if you follow the link there. We've also got Nottingham City Care's Homeless Health Clinic as well, and there's a link there for you. Benefits advice and support with claims, support and arranging appointments, etc. Can also be provided at Emmanuel House, who can also provide a winter shelter for homeless people, wellbeing support and regular activities for people to get involved in. We've also got on here the number for the Street Outreach Team, Nottinghamshire, if you're worried about somebody sleeping rough, or perhaps we have a homeless person that comes in who says they're struggling, or you know, they can't get warm and we know where they're sleeping. We can take a location and make sure a team of professionals can come out and support that person. So you'll see on this slide, for any financial issues, and that could be about benefits or debt, Bestwood Advice Centre, a welfare rights service run by Nottingham City Council, the Stepford Money Advice Centre, the Citizens Advice Nottingham and District Centre, the Meadows Advice Group and the Nottingham Law Centre also give advice on financial issues. And if a person has a disability, always advise disability support, which provides financial and benefits advice and support for people with disabilities who live both in Nottingham and the Nottinghamshire district. General advice I'd give to people with health issues is, if anybody describes any, advise them to list their symptoms on a piece of paper and to see their general practitioner and hand over that list to the doctor. And you might, even if they think it's a specific condition, signpost them to tell them to put NHS and then whatever condition they've got in a search engine and bring up that list of symptoms, and then tell the person to go through those symptoms and to list the ones they've got to give to a doctor. Advise them to request an appointment with their surgery social prescribing link worker too. So a social prescribing link worker can help them explore groups or activities which may support them with their health concerns. And incidentally, if somebody is already speaking to a doctor, well, doctors, if they're not referring already to a social prescribing link worker, will take note of a social prescribing link worker, particularly if one of our visitors has a health condition or they don't feel they're being taken seriously. Social prescribed link workers are a great asset to help visitors there, as they are also to help people with any sort of low-level social problems, maybe with housing, signposting to benefits, loneliness, or even advice around mental health. And also, if their health impacts are impacting their ability to take care of themselves, advise them to call adult social care to discuss whether social care can offer help and assistance. And to find out if they're eligible for adult services, they can call the Nottingham City Health and Care Point on the number on the slides. There's also www.notshelpyourself.org.uk, which basically will advise on any support group across Nottinghamshire on a range of issues that your visitor might experience. If a visitor is reporting mental health issues, advise them to contact Nottinghamshire Mental Health Line for support, and more about that on the next slide. If a visitor is reporting mental health issues, advise them to contact the Nottinghamshire Mental Health Helpline for support, and this offers 24-hour access to support people who need emotional support, somebody to chat to about their mental health at any time of the day. So as opposed to a counselling service such as the Samaritans, this line will be there to give practical advice, support and strategies, as well as a sympathetic ear to anybody who calls up. And they also provide personalised advice. I've said that, having information on coping mechanisms, and also digital support and signposting. So if it's a low-level mental health problem, well, it's a mental health problem where you don't think they're at risk, but they really need to speak to somebody, that would be your first good point of call to signpost to. Now, if you do feel the person is at risk, or you think they might be at risk of harming, hurting, killing themselves, trained support workers are now employed to work via the 111 telephone number. So the alternative of 999, you can advise people to select the option that says talk to a mental health worker by calling 111 if they need urgent help. So the other piece of advice might be if they're near an accident and an emergency centre, or it's in doctor's time hours, then they could also turn up at a doctor's surgery, or make an appointment with a doctor, or turn up at accident and emergency. However, they're going to have a big wait. So 111 might be a quicker way for them to get urgent help. If they feel unsafe, or they feel like they need to go somewhere before hospital, I highly recommend the Nottinghamshire Crisis Sanctuaries. So if you follow that link there, you'll find that these sanctuaries are set up to prevent people getting into emergency situations. So you may well get somebody who's feeling suicidal, but needs to go somewhere safe to speak to a professional, and that intervention alone, which is non-clinical, it's not like in a hospital setting, may be enough to give somebody hope. So always advise those, because they've also got a phone number, and people can literally turn up. There's one called the Wellbeing Hub, which is at 73 Houndsgate in town, which is the nearest one to Sherwood, and that's open on an evening. As we mentioned, also we've got the Samaritans, we've also got Sane Line, we've got Shout, which is a text service. Any of these conversations you have, please share them either with your lead, a volunteer, or myself, and we'll have a good chat about it, and I will reassure you that you've done everything you have done, or if we think there's anything else we can do, we will do that and put that in place. Please never feel alone when you're dealing with people that are poorly and distressed because as a result of mental health. So if somebody's talking and perhaps they've got a deep-rooted problem that's happened in the past, or something that's still bothering them, advising that they access talking therapies or counselling is a good piece of advice. And sort of demystifying, if you like, and taking away the stigma of that is also good, because you can literally these days either contact Transformed Counselling Services or Nottingham or Nottinghamshire Talking Therapies by a phone call, or you could even make an online referral, probably quicker than you can go onto Amazon to buy something, because these are NHS funded, and the idea is that people can quickly access therapies when they need them. So people won't be looking at a big wait there, but they can quickly get access to a trained counsellor, somebody to listen to them, not necessarily to advise, but to help them talk about and get through what they've been through. I've also got here a Nottingham NHS IAP locator. Don't even ask me what IAP stands for. I think it's Instant Access Something Therapies, and that is a locator basically for wherever that person lives. They put the postcode and it'll tell them the local NHS service, and it'll give a link to them. Honestly, referring to therapy is as easy as that. Now, I've also put a link there if people want long-term counselling. Unfortunately, long-term counselling is a bit of a thing of the past, unless people want to pay for it through a private practitioner. But I've also put a link here for Nottingham Counselling Service, who are a low-cost counselling service who use therapies that take a longer time. So things like psychodynamic therapy, every therapy's gone out of my head now, but basically not a therapy within 4 to 6 weeks, which is a therapy currently favoured by NHS approaches. Sometimes as well, it's always worth just telling them also, you know, to look on the iApp locator, as they might find as well, or even if they do a search for local counselling service, free or donation based, they might actually find other counselling services. And hopefully as we get our leaflet rack together and established, we'll have plenty of these leaflets, so we've got plenty of scope and places to refer people to. So for any substance abuse issues, so drinking or illicit or even prescription drugs, I'm going to keep this really simple, and I'm going to give you 2 places to refer people to. Either Nottingham Recovery Network, which is based in Nottingham for the people of Nottingham, or Change Grow Live Drug Services, which are for the people who live in Nottinghamshire County. Now I could tell you about lots of links for the AA or Narcotics Anonymous, but being a fellow past drug worker myself, I would always say that I would prefer people to be seen by a drug service who can then advise on the best place to get their support and recovery. And by seeing a drug service, that person is going to get a medical, they're going to get a whole assessment of their needs and a really sort of holistic approach to any other situations or things happening in their lives, or people impacted such as children, partners or families. So both those agencies are very good, and you'll see their contact details now. And again, as you're talking to people, just kind of take away the stigma and say, you know, it's understandable. A lot of people have addiction issues. Okay, yours might be drugs, but some people might be addicted to food, gambling, I don't know, watching rubbish TV, relationships. Just always deal with non-judgment, because these people are just like us, they're human. You know, and at the end of the day, sometimes we all need support when things get out of control. So legal support, people who need legal support, the days of getting legal aid are quite behind us, although some people can still get legal aid, but it's a very difficult process. So please advise people to get expert help and advice and support either from Nottingham Law School, who are based at Nottingham Trent University, or Nottingham Law Centre based in Hyson Green. If a visitor expresses concerns about a child they know or needs the details for City MASH, which stands for Multi-Agency Safeguarding Hub, give them this phone number here, 0115 876 4800. They can also, if they're concerned about a child and live in Nottinghamshire, the number they need is 0300 500 80 80. And there's also a number here for the emergency duty team, especially if this is out of hours, i.e. Monday to Friday, not Monday to Friday. The number then is 0300 456 4546. A lot of people might come in and they might say they're unsure of whether to call social care at this stage, and this is often a conversation you might have had it with neighbours or friends, but they're a bit concerned. Maybe they're concerned about let's say some neighbours. There's a really good helpline that people can ring for the NSPCC, and it's free, and that's 0800 800 5000, and that website is also really good as well. So I'd highly recommend the NSPCC, who will be able to give really good advice on what to do. And if somebody is concerned about a child and family who are not abusing a child but need help, so maybe that child and family have no money and they're struggling, or things are really destitute, they can contact the early help team to attain help for children and families in Nottingham. And the numbers are, for this one is 0115 841 555. If they live in Nottinghamshire, the number is 0115 804 1248. If somebody reports domestic abuse to you, first assess whether they are safe or whether they need a safety intervention, i.e. such as a call to the police to help them get to safety or be protected. But also advise the following of agencies who can provide support. So we've got Equation Advice for support for women, men and young people who experience domestic abuse. So that's a really good website there with lots of information so they can make that decision themselves. We've also got Juno Women's Aid for people experiencing domestic abuse in Nottingham and Nottinghamshire on 0808 800 0340. Or we've also got, and that's their 24-hour free line, or in the daytime 0115 947 5257. There's also a men's advice line for men experiencing domestic abuse, which is 0808 801 0327. As you know, we're not a food bank, so it's important to signpost people to food banks that are set up to provide regular food to people who visit us. And our local ones are, we've got Arnold Food Bank, but they will need a referral by a voucher though, and that's based at Daybrook Baptist Church. And they usually take referrals either from the Citizens Advice Bureau or used to do through somebody's job centre coach. An easy one to access without all that is HIMA, and to be referred to the food bank service at HIMA and to receive a week's worth of food supply. The visitor needs a support worker referral or a referral via Nottingham City Council's Welfare Rights Team, or even us, as I'm a referrer, to refer this person to the food bank. We've also, even easier, we've got Mesopotamia, who has a low price charity shop as well as a food bank. People can either self-refer or even in person via their website or turn up at their shop. And Mesopotamia even offer, ongoing food support. Quite locally too, we've also got St Anne's Food and Sneinton Food Bank, although they do need to know that somebody has no income to be referred there. Okay, which is really important, especially for a lot of our older customers who will struggle with the rising cost of living. These are free meals they can access throughout the week. So we've got Muslim Hands, the open kitchen, which is open 7 days a week, which serve free meals to rough sleepers, low-income families and refugees in Nottingham. There is also a Meals on Wheels service for the particularly vulnerable, such as maybe our older people that visit. And the kitchen servers are based for other types of assistance too, including distribution of sleeping bags for homeless people, essential household items for low-income families too. Then we've got Saloom Shalom Kitchen, which offer a free cooked meal every week accessible for everybody on a Wednesday night at the Bridge Centre in Hyson Green. So that's Wednesday covered. Monday and Friday we've got Shifting Your Mindset, who offer a free cooked hot meal and a pudding at the Hyson Green Youth Club at Terrace Street, Hyson Green, and also serve a hot meal. I've said that, haven't I? Yeah, for anybody who wishes to access it. So there's no referrals, none of these have referrals, literally anybody can turn up. For anybody who we might see who's a refugee, they provide a free meal from 12 till 1 p.m. from a Monday to Friday to clients of their service, as well as hot drinks, Wi-Fi access, leaflets, all sorts. And also the cafe provides volunteering opportunities for clients of the service. So if we've got anybody who we think is a refugee, let's definitely signpost them that way, so at least as well we know they're getting a good service there. We got people that want to go to a donation meal. Please signpost them to Share in Sherwood, which happens on the second Sunday of every month. Minimum donation of £2.50 is expected, although people can choose not to pay, but they do prefer an Eventbrite ticket. We've also got Food Cycle community meal in Broxtowe and Aspley, and that is every Tuesday at 6 p.m. So in theory, what we could do is we could advise people to go to Shifting Your Mindset for a free meal on Monday night, Food Cycle community meal in Broxtowe and Aspley on a Tuesday night. Then we could advise them on a Wednesday night to go to Salom Shalom Kitchen in Hyson Green. Thursday night they'd have to go to Muslim Hands on Mansfield Road, and Friday night again they could go to Shifting Your Mindset. So at least we've got 5 hot meals there provided free of charge potentially. So good tips for teamwork. Whenever you're working in the exchange, you must be conscious of where your team members are at any time. So please be vigilant to any signs of distress or aggression from visitors, as all could potentially put your team member at risk. So if you hear that the visitor is crying, be nearby and let it be known that you're also hearing this distress, so the visitor knows that your team knows that you are supported. Even if they're crying, or obviously if they're raising their voices, definitely be by the side and be ready to intervene. Likewise, like I said, if voices become raised or you see a visitor stepping into another team member's space, become involved in that interaction and recognise that space invasion could be a sign of aggression. So all the time work as a full team and know where each other is. Even if these encounters are innocent, this will at least give to the impression to the visitors that we are one unified team. Thus, should any visitor arrive angry or want to project their anger onto us, they will think again, as they will see and feel that we're working together as a unified team and we don't take any shit. And in the same way, if you feel upset, not too well or less than friendly when you arrive on shift, be open and tell the lead volunteer that you're not feeling too pleasant, so that they can arrange for you to have less interaction and for your team members to step up and have more customer interaction whilst you don't. There's nothing wrong with admitting when you're not feeling it. We all have bad days, and part of working within a good team is knowing when to step up and to support your teammate and taking one for your teammate, as in return you also know then that there might be times when your team member needs something from you, and that is when you know you're working in an awesome team. And just as I say, always feel that you can be honest. It's not a problem at all. A good team always works together and supports each other, and a good team has valuable components, and you're all important in our team. Now let's go on to a feedback sandwich, also referred to as a poo sandwich, or even a slightly more ruder word. And we're all from different walks of life, and some of us are more sensitive to criticism than others. Therefore, when you need to give feedback to another teammate whilst on shift, it's important that you adopt the feedback sandwich approach, as this will allow you to deliver your critical feedback in a positive way and not upset your teammates. So, to deliver your perfect sandwich of criticism, think of the bread around the filling as the positive comments and the filling of the sandwich as your criticism or point you need to make. So start off by focusing on the strengths, what you like about them, or the action in question. It might be I think you're really sound, I notice you do this well, and then you're going to get ready for a however. Then provide the criticism, things you don't like or any areas of improvement. So you might say, however, I did note when you did this, blah de blah, this happened. Then you want to you always end off with a positive by reiterating the positive comments you gave at the start. So the positive results can be and also positive results that can be expected if the criticism is acted upon. So for instance, you might say, Thank you for hearing me out. I really hope we can move on from this. It's not personal, because I really like working with you, for instance, would be a perfect sandwich. And it's called the feedback sandwich because you wedge your criticism between opening and ending, like a patty wedged between two buns. But those buns need to be nice and fat and full of compliment and respect. And once we do that, we're able to communicate even more easily. And you might even find that the person just says, look, this is fine, just tell me straight, because not everybody is as sensitive as others. But what that will do is allow you to feel comfortable with making criticisms, as nobody likes conflict, do they? And nobody likes to have to give uncomfortable conversations. So, dealing with complaints and compliments. So if anybody has anything nice to say about us, please encourage them to use our online feedback page, as we will be very happy to receive it, which is available at www.thesherwoodexchange.co.uk. But likewise, if they've nothing positive to say, they can also use this feedback page to get their opinions across. If they prefer not to use the internet and would like a phone call, please take the details and tell them that somebody will call them. So take a name and a phone number and let me know the incident or what the nature of their complaint is. Likewise, they can write to us too, so you could give them our address, and if they address the letter to complaints, the Sherwood Exchange, 2A Melrose Street, Sherwood, Nottingham, NG5 2JP instead if they wish to complain. Lastly, and most importantly, when you're working in the exchange, you may be left alone when, let's say, you're working alone in the food exchange when the centre is quiet and occupied by other groups. There might be you in another one. That could be classed as lone working in an empty place. Or when you're at meetings in unfamiliar or empty venues, or activities such as parking vehicles at night or in low level lighting. Or you might be travelling by bus, car or public transport to us. Or you might be attending meetings or promotional activities in public places. And there might be elements where sometimes you might be left alone. And not forgetting as well, if you happen to be on shift and say your teammate is showing somebody something or somebody's gone to the toilet, you may well be left alone in the exchange momentarily, in which case you may well then be subject to lone working. However, whatever your role and whatever work or whoever you're working with, you're responsible for ensuring that you are working in a safe environment and that you safeguard your own and others' personal safety. Should you ever be the first to arrive on shift or the last to leave, or happen to find yourself alone, please message arrived or completed into the WhatsApp group, so somebody always knows your whereabouts and that you're in the building. And again, should anything happen to you, etc., we know where you are. Yeah. We will always have at least 3 volunteers recruited on each shift to ensure that you're not left alone, should a volunteer wish to take a break or use the toilet, for instance. However, if only 2 people turn up on shift, please contact myself, Rachel, or speak to your lead volunteer if you don't feel comfortable as soon as possible, so a decision can be made as to whether we open or close for that day. Because your feelings of confidence and security are absolutely essential here. Nobody can work if they're not feeling safe, and that just will not happen. So please be assured that if you don't feel safe, please communicate it. As I've mentioned before, please also have 999 inputted into your mobile phone under the heading of a emergency, should you ever need to call for urgent help if you ever need it. However, the biggest thing we can tell you today is that if you ever feel under threat or need to discreetly communicate that you need help or assistance at any time, and this might either be to your work teammate who's working alongside you, or you might have to phone up the WhatsApp group or myself, your code phrase is is Amy on shift today? And basically you might say, if you know what you need, you might say ask for Amy P, which is Amy call the police. P stands for police, or Amy A if you need an ambulance. And if you happen to receive this message over a phone call, please speak quietly and ask yes or no questions. So no open questions here, just yes or no to whoever is calling you, so not to put them in any danger if they were to make the call in front of a person who is making them feel threatened. Yeah, so again, just say, should I call you an ambulance? Is the person threatening you? Yes. You know, those sort of questions. So again, the person can just say yes, yes, yes. So I'm going to call an ambulance now, is that what you need? And the person goes yes. Would you like to stay on the phone after I've done this? Yes. Would you like me to ring you back? Yes. All of those questions, just ask them for a yes and no response. Please also refrain, and we said before, from making friendships with visitors, and adhere to professional boundaries at all times. Because again, you know, if you're alone working with somebody who's a bit chummy with you and they overstep the line, again, that could put you in a compromising position. I've said as well, you know, to protect yourself, decline to meet any visitors or third parties anywhere other than the premises used by the Sherwood Exchange. Again, to protect you, because we don't really know these people, do we? And also, they're coming to you for a service. It's a different relationship, because that rather than them being wholly equal as your pal outside the exchange. And finally, anybody working from home should consider the risks of any meeting arranged outside of a workplace, e.g. a person's home. So hopefully I've never done a meeting yet at somebody's home. But again, if you were to attend a meeting and it was through the exchange, I would never ask you to go to somebody's home. But say if there was something that, again, that made you feel uncomfortable, let us know. We get you a taxi or an Uber or whatever, because again, you are so important to us. And whenever a meeting has to be attended, committee members must inform at least one committee member that they've arrived home safely. Yeah. Thank you so very much for completing this training and listening to my voice throughout it. I hope you've got lots of information from this. If you've got any further questions, please get in touch with me. And if you're interested in learning an intervention and skill on how to advise visitors in what we call solution-focused interventions, you may wish to undertake the solution-focused training session. However, if not, please ensure that you've completed alongside this one here the policies, procedures, health and food safety, food exchange training too. And with these training sessions, not only will you get a certificate, but you are also now able to work within the exchange.